Nurse Paul, I've reviewed Mr. George's recent CT scan. There are some concerning findings that require further evaluation.
What are the findings, Dr. Mihira?
The CT scan shows a mass in the lung. We'll need to conduct a biopsy to determine the nature of the mass.
Should we inform Mr. George about the findings?
It's important to be honest and open with Mr. George. We can schedule a meeting to discuss the findings and the next steps.
What are the potential treatment options?
The treatment will depend on the biopsy results. If the mass is benign, we might monitor it closely. However, if it's malignant, we'll need to discuss treatment options such as surgery, chemotherapy, or radiation therapy.
Dr. Mihira, I'll schedule a meeting with Mr. George and his family to address their questions and concerns. I completely understand your concern, Mihira. It's normal to feel worried when your child experiences something new, especially when it's unexpected and there's no prior history of health issues. The good news is that asthma is a very common condition and can be very well controlled with the right management. There are many effective strategies to help prevent future episodes and keep Leo healthy. The first step is to schedule an appointment with your GP to get a clearer picture. They can conduct a thorough examination and recommend any necessary tests to understand the specifics of Leo's condition. Subsequently, the GP can create a personalized treatment plan and provide appropriate medication to help manage his symptoms. Mihira, with the proper treatment plan, including medication and avoiding known triggers, Leo can lead a normal, active life.